Hello, everyone, and welcome to today's webinar, a national update related to COVID-19. My name is Dominika Krzemińska, and I'm the Director of Programs and Strategic Initiatives at the Canadian Housing and Renewal Association. Thank you all for joining us. Before we begin, I'd like to give a brief overview of how today's webinar will work and the webinar technology, and then I'll introduce our speakers for this afternoon's presentation. Today's webinar is in real time. You should now be able to see a title screen of today's presentation, and you should be able to hear me via your computer speakers, headset, or through your telephone if you have chosen to dial in. You're currently all muted. We do this to minimize background noise. If you wish to ask questions, you may type them in the chat box on the webinar control panel at any time during the presentation, and we'll get to your questions at the end of the presentation. Questions can be asked in either French or English. Vous pouvez poser des questions en français ou en anglais. Before I pass it on to Jeff Morrison, Executive Director of CHRA, to provide opening remarks on behalf of CHRA, I'd like to introduce who will be presenting in today's virtual space. And you see them, some of them, on your screen today. So today we're joined by CMHC's Romy Bowers, Senior Vice President of Client Solutions, Glenn Furlong, Senior Specialist Client Relationship Manager, and Eric Lapointe, Gestionnaire Principal, Relations Clients et Opérations, Administration de l'Assurance, and other CMHC colleagues who will take part in the question and answer session at the end of the webinar, including Véronique David, Director of Agreement Management, who you see on your screen. We are also joined by Janet William, Director of the Homelessness Policy and Partnerships Division at ESDC. Thank you all for joining us. CMHC and ESDC will provide updates on measures specific to the community housing and homelessness sector in Canada related to COVID-19. Jeff, over to you.
Well, thanks, Dominika. And I just really have two things I wanted to say before passing it on to our guests. Premièrement, je sais que vous savez tout que ça c'est une situation sans précédent dans l'histoire du Canada, qu'il n'y a aucune planification que les autres peuvent faire dans une situation comme ceci. Mais je veux dire, au part de la crue, mais aussi au part de vos locataires, un très grand merci pour tout vos travail dans cette situation, pour vos travail extraordinaires dans les circonstances très difficiles. Il y a beaucoup des articles, des histoires des gens comme les gens qui travaillent dans les hôpitaux, par exemple, qui sont vraiment les héros dans cette situation. J'espère que tout le monde, que tous les Canadiens connaissent que les gens qui travaillent dans le logement abordable sont encore et aussi les héros dans cette situation. So just to repeat, this is obviously a situation without precedent in history. No one has any plans for this. I mean, no one has ever, really faced a situation like this. So I just want to say, on behalf of CHRA and behalf of, I hope and I think, all Canadians, and especially your tenants, a huge thank you for your extraordinary work in ensuring that people are housed safely, securely in this incredibly difficult time. You're doing an amazing job. We see it from the media articles, from social media, etc. And I know the media talk a lot about healthcare workers and other essential services that are doing really heroic work. But I want to make sure you all understand you're all doing heroic work as well. So thank you. The second point I want to make is to say a very similar thank you to the folks from the federal government, because I know sometimes people can bash government for this or that reason, but the reality is that the federal government has responded incredibly quickly with a lot of information, a lot of new programs that in a lot of cases literally had to be developed on the fly. Normally programs that would take months, if not years, to put together. So the reaction and the response that we've seen from CMHC, from ESDC, from finance, from other federal departments has been just really incredible in an incredibly short period of time. So I want to say a huge thank you to the folks from the federal government who've done, again, really extraordinary work in a really short period of time to respond to what has been an unprecedented situation. So encore pour les gens qui travaillent pour nos gouvernements fédéraux, je veux juste dire un très, très grand merci aussi pour votre réponse et votre travail durant cette situation sans précédent dans l'histoire du Canada. So that's all I wanted to say. And with that, I will pass it over to our colleagues from CMHC and ESDC who will go through what those various measures that they've introduced have been and how they affect you as housing providers. So I think, correct me if I'm wrong, Romy, I'll pass the virtual baton, by the way, the virtual baton over to you.
Yeah, thanks so much, Jeff, and I really appreciate your invitation to this event. We think it's a really great thing to have this kind of communication with your members during this very difficult time. So thank you for creating this opportunity for us. And I just wanted to let everyone know we do have a few prepared remarks to convey some very essential information to you, but then we wanted to open things up for questions. We may not be able to answer everything, but we'll make sure we take all questions away and that will provide answers to you in due course. So first of all, this goes without saying, but at CMHC, we're continue to monitor developments around COVID on a daily basis, and we're calibrating our response as new information becomes available to us. As you can imagine, our primary focus is on the health and safety of our staff. And we're focused on this because we want to make sure that we're here to serve Canadians and that we're ready to execute on the various programs that the government has developed in response to this unprecedented situation. We are working very, very closely with our federal partners, and we've implemented a number of measures to mitigate the impact of this crisis for our clients and for Canadians in general. Nous travaillons en collaboration avec nos partenaires fédéraux et nous avons mis en œuvre un certain nombre de mesures pour atténuer les répercussions de la COVID-19 pour nos clients et les Canadiens. Help for Canadians and for Canadian businesses is being provided through a whole of government approach, and I'm sure you've seen that if you've been following the news. In addition to the tools and relief measures being offered through CMHC, there are a number of other tools that are being offered by the Government of Canada as part of the Economic Response Plan. So if you go to the Government of Canada website under the Economic Response Plan, you'll find there a whole listing of measures that the government has enacted. And you'll notice that these are updated on a daily basis. And CMHC in turn, if you look at our website, we're doing updates as well. So we encourage you to follow our websites very closely and pay particular attention to the new information that comes to light. The scope and scale of the Government of Canada's fiscal package in response to COVID-19 includes money to help our most vulnerable citizens. And this support is to support these citizens pay their rent and put food on the table. To ensure that Canada's most vulnerable groups have the support they need, the Government of Canada announced providing the Reaching Home initiative with $157.5 million to continue to support people experiencing homelessness during the COVID-19 outbreak. And as was mentioned at the early part of this call, we have Janet from ESDC on our panel, and she'll be able to provide you a little bit more information about this in due course. In addition, the federal government will also provide $305 million for a new distinction-based Indigenous Community Support Fund to address immediate needs in First Nations, Inuit, and Métis Nation communities. We wanted to note that of this, $50 million is available for urban Indigenous organizations. CMHC is looking at what more we can do to support vulnerable populations and the nonprofit housing sector. We understand well that the current circumstances may impact your ability to provide housing solutions for Canadians. Please rest assured that we are prepared to exercise flexibility in providing favorable solutions to you so you can continue to serve your clients and provide housing affordability. These events remind us how crucial it is for all of us to have a sanctuary. We believe that all Canadians need a safe and affordable place to live. The first defense for renters, we believe, is income support measures. We expect any housing provider who has received funding or mortgage loan insurance from CMHC or through funding from provinces and territories to act compassionately and refrain from evicting their fellow Canadians. We expect landlords to suspend evictions. And you probably may have seen that our CEO, Evan Siddall, has been quite prominent in his social media feeds and also on the media, emphasizing the need for compassion and for understanding for all people involved in the housing sector during this very difficult time. Nous nous attendons à ce que tout fournisseur de logement qui a reçu de financement ou de l'assurance prêt hypothécaire de la Société canadienne d'hypothèque et de logement, directement ou par l'entremise des provinces ou des territoires, agisse avec compassion et s'abstiennent d'expulser des concitoyens canadiens. Nous nous attendons à ce que les propriétaires suspendent les expulsions. Rental housing falls under provincial jurisdiction under landlord-tenant legislation. Several provinces and territories representing approximately 83% of Canada's population have issued full or partial eviction bans. And we view this as a very positive sign. We're offering our clients assistance with financing tools and are deploying a range of solutions to help as well. This will give everyone the chance to shelter safely and provide the necessary time for emergency funds from the federal government to be dispersed to Canadians. Landlords with CMHC insured mortgages, and this is a fairly large segment of the market, who are facing financial difficulties have access to the same tools and relief measures as homeowners, such as mortgage deferrals. This will give landlords the financial flexibility they need to show compassion and patience to their tenants during these extraordinary times. Housing providers have a very important role to play in preserving our economy during these times, and I just wanted to stress that we're truly all in this together. Les fournisseurs de logement jouent un rôle important de soutien de notre économie dans ces circonstances exceptionnelles. Cette situation nous concerne tous. We have a number of experts on the call from CMHC today who will provide you further details on the various relief measures that are being provided by CMHC at this time. So with that, I'd like to pass things over, I guess the virtual baton, over to Eric Lapointe.
Thank you, Rumi. I hope you all hear me well. Bonjour tout le monde. So I'll be speaking mostly about CMHC as a lender and what deferral means, and going through you on the details of a deferral payment. But I would like to also say that CMHC has worked with as a mortgage loan insurer with the different lenders, trying to convey the same message that I'll be conveying this afternoon to you. So CMHC recognize that many of our clients are facing financial challenge and uncertainty as a result of COVID-19 outbreak. So effective March 25th, CMHC will consider providing up to 6 months of loan payment deferral, principal and interest for borrowers that have CMHC finance loan in good standing. Afin de soutenir tous ceux qui sont touchés par la COVID-19, la CHL pourra considérer dès maintenant un report de 6 mois de paiement, capital-intérêt aux emprunteurs dont le prêt est en règle. Deferral requests must be made in writing and will be considered on a case-by-case basis. Where CMHC is the lender and approved for a deferral request, this means that a regular scheduled loan payment will be postponed up to 6 months. The outstanding debt will increase if the option is exercised, as interest will continue to accrue during this period. The housing providers still remain responsible for repayment of the deferral principal and unpaid interest at the later date. If the loan payment deferral is exercised, CMHC will work with the housing provider to determine a repayment plan. This plan could include, for example, making a lump sum payment, adding the deferred payment to the loan balance at the term of renewal, or establishing a modified payment schedule. For housing providers, CMHC expects that borrowers exercising this option will extend their support to renters and also so that their housing needs continue to be met. Dans le cas des fournisseurs de logement, les CHL s'attendent à ce que les emprunteurs qui ont recours à cette option offrent leur soutien aux locataires et aux ménages pour que les besoins de logement de ces personnes continuent d'être satisfaits. Prior to requesting a payment deferral, we're asking housing providers to carefully consider their unique situation and assess how COVID-19 pandemic is impacting their project viability. This includes exploring the availability of other government support programs and ensuring tenants do the same. Income supports can be used in part to pay rents. The majority of our borrowers will likely only require temporary assistance as a result of COVID-19. However, other tools can be considered on a case-by-case basis. For account, there are already in areas before the pandemic under an existing special payment arrangement or work out with CMHC. And if you're experiencing further difficulty due to COVID-19, the usual CMHC representative or other partner you're currently working with can be contacted for further assessment. We have a deadline to receive the requests as of June 31st, 2020, but this date may be extended depending on the impact of COVID-19. Extension will be communicated by CMHC in writing and posted on our website. La date limite pour présenter une demande de report de paiement est le 30 juin 2020. Cette date, par contre, pourra être reportée selon l'impact de la COVID-19. Les CHL communiquera communiquera par écrit et l'affichera sur son site web cette information. Deferral requests will need to be made in writing and supported with information on the impact faced by the borrower and the project, including income and available funds to offset near-term cash needs. Housing providers that needs to take advantage of this payment deferral can contact us at 1-800-668-2642 or by email at contactcenter@cmhc.ca. We ask you for your patience as our contact center is experiencing high call volumes in this period of right now.
So Glenn was going to talk about the Federal Community Housing Initiative. So as many of you know, phase 2 of this initiative provides new rental assistance support for federally administered community housing providers who are reaching the expiration of their operating agreements. In the context of the ongoing COVID-19 outbreak, the launch date of the phase 2 initiative has been delayed from April 1st, 2020 to September 1st, 2020. For eligible housing providers who have opted into FCHI 2 and who have existing operating agreements expiring in the coming months, the current levels of financial assistance will be maintained until the end of August 2020. This delay allows adequate time for eligible housing providers to review the documents and also have the board of directors sign the new agreement. So we feel that hopefully this additional flexibility will provide everyone with the chance they need to do the necessary review. We are extending legacy program subsidies until the deferred launch of the new FCHI 2 program for housing providers who have legacy housing agreements expiring between now and the revised launch date of September to avoid any interruption of funding. With respect to reporting requirements under existing operating agreements, and this refers to audited financial statements, budgets, and other materials. For financial statements and other types of reporting that housing providers are required to submit to CMHC according to their existing operating agreements, please be reassured that we'll be very flexible with respect to timelines for the submission of these items. Housing providers should continue to try meeting their reporting requirements as much as possible. However, we are very cognizant of the fact that there are operational challenges in the current context, such as obtaining board approvals of financial statements and budgets and matters of that nature. Please rest assured that CMHC will not impose a penalty if reports come in late. With respect to subsidy suspensions, to ensure steady flow of funding to housing providers during this very difficult time, CMHC will not initiate new subsidy suspensions for accounts as a result of any breach in their agreements. With respect to physical condition reviews, in keeping with the safety directives issued by the relevant public health and government authorities, physical condition reviews will be limited or in some cases temporarily suspended. So I think that was it from the Glen side. So I think I'll pass it over to the moderator and for the next speaker.
Sure, thank you so much, Romy. I think we'll pass it on to Janet now to provide an update from ESDC. And then, like I said, we'll open the floor to questions. So if you are thinking of questions that you have, you can type them in at any point and we'll get to them at the question and answer period towards the end of our time. Thank you. Over to you, Janet.
Thanks very much, Dominica, and thanks, Jeff and CHRA for inviting me to be here. And I echo Jeff's comments around just the enormous work that housing and homelessness providers are doing right now, just on the front lines. We thank you so much for being with us today and just doing so much heavy lifting during such a difficult time. We're really grateful. So I just want to give you a quick update on where we're at with the $157.5 million that the Prime Minister announced on March 18th. Thanks, Romy, for mentioning that. We're working tirelessly to get this money into communities across the country through our community entity network. And that is happening right now. All of our community entities have been advised of what their allocations are, and now that we have royal assent on the legislation, we're just working through the mechanics and the details of actually flowing that funding, and we hope that it will be very, very soon. So we know that the needs are there and that it's urgent. We remain in constant contact with our national, regional, provincial and territorial counterparts and our stakeholders at the community level to have as much real-time information as we can about the situation on the ground and what the emerging needs are. We continue to have calls with our provincial and territorial counterparts, as well as Indigenous governments and our Indigenous partners as well. We have been working very closely with the Public Health Agency of Canada to provide sector-specific guidance for COVID-19, and that was released last week. So if you haven't seen it, please go to the Public Health Agency's website. It is there. I can also provide the link to Dominique and Jeff for distribution. It's very helpful. It's based on the Center of Disease Control guidance for the homelessness serving sector, and we're quite pleased that we were able to get this out so quickly. It does have some very good guidelines in there for homelessness providers. For our program, we have directives that are in place, and we are updating those directives right now to have COVID-specific guidance provided to communities where we're showing a lot of flexibility in terms of what that additional incremental funding can be used for, and we hope to release those very soon. So stay tuned. We'll have our website updated very soon, and with respect to eligible and ineligible expenses, it will be very clear about what the COVID-19 money can be used for, and those directives will be in place until this crisis is over. So it's going to provide our communities with quite a lot of flexibility in enabling their responses. I just want to thank everybody again in the sector for their incredible leadership on this. It's just the community response, particularly around those who are serving people who are experiencing homelessness, those who are precariously housed, has just been overwhelming, and it's been amazing to see people mobilize. You know, we know that communities are best placed to understand what their local needs are and what their challenges are, and we're really open to hearing what those are, and we hope that you reach out to us and let us know. I just want to be a little bit more specific about what communities are telling us that they're going to be using their incremental money for, and we're certainly going to make this clear, but just to be very clear, you know, shelter barriers, so dividers in shelters, additional hotel or motel spaces. We've seen community centers that are being commandeered, I guess not the best word for it, but are being used as isolation centers, as quarantine centers, as enabling to reduce the shelter population and enable that social distancing with people who are experiencing homelessness. We know that people are experiencing food insecurity, so that's part of the response as well. So there are a lot of different measures that communities are implementing right now to really try and get ahead of a pandemic spread within the homeless population. We really just want people to understand as well that Women and Gender Equality Canada also announced a up to $50 million investment. And so that is going to be flowing into communities as well. But just to be clear that those organizations that are serving women specifically or violence against women shelters are certainly eligible to receive Reaching Home funding. So I just want to make that really clear, because I think that there may have been some confusion in communities. So I think we really want to encourage that collaboration between the VAW sector and the homelessness serving sector at the community level. And we know it's happening across the country. And also to please work with your Indigenous organizations in your communities as well, to make sure that culturally appropriate supports are being put in place. I know that these are really difficult times. I really feel like we're on the right track in terms of getting the funding out as quickly as we can. And you know, the safety and well-being of all Canadians is the most important thing to the Government of Canada, and that includes those who are experiencing homelessness. So I think those are the updates that I have. Thank you.
Thank
Happy
you,
to take
Janet.
questions.
Yeah, for sure. Thank you, Janet, and thank you to all of our panelists today. Like we said, right now we have a bit of time for some questions, and any questions that are not that we cannot answer today, we will provide you a response to afterwards. So I invite you to type in your questions if you have them. I see a couple have come through. I'm just going to unmute a couple of CMHC staff here just to make sure. I think Patricia, you should be unmuted now. And Lindsay, you should be unmuted as well. Okay, so I'm going to start with the first question. It's more of a, well, it's a comment, and then there's also a question that may or may not have an answer right now. But the comment is, doesn't eviction suspension right now realistically mean that we're just moving down the road into the future? And if someone, you know, has April and May rent debt, how are they expected to pay that off without financial support? So is this something that's also being discussed in this whole context of asking, you know, landlords not to evict?
Yes, I'll take that question. Yes, it's something that's obviously we're aware that I think right now we're sort of responding to the immediate crisis, but obviously we realize that if things like rent deferral, it does push things out further along. But we feel that it gives us a little bit of time to think about what we can do next and have a thoughtful approach how to address that. So please rest assured that numerous not only CMHC, but obviously, but there's a whole of government approach to answering that question. Unfortunately, I can't answer it definitively right now, but it's something that's of top of mind to the policymakers and obviously the political leaders as well.
Great, thank you, Romy. So the next question is, do you know if social housing landlords will be eligible for the BDC, the Business Credit Availability Program short-term loans? No. Yeah, sorry. Does anyone have a response to that one?
Yeah, so maybe we'll take that one away and we'll provide a response to you. Yeah.
Okay, great.
Later,
Okay.
later if that's okay.
Yes, no, for sure. And I can share that response with all of the participants on this call. So
Yeah.
Ray, your question will be answered. The next is, and this, because we're talking on a national scope, I don't know if we'll have an answer to this, but Jeff, you may actually be able to take this question, especially because of the work that we're doing with CANFA right now. The question is, can anyone share any, and this is something we may need to take back, can anyone share any unique initiatives that other provinces are doing to support community level housing providers and low income renters at this time?
Sure, I can jump in. One thing that CHRA has been doing and will be continuing to do on a bi-weekly basis is meet with our provincial association counterparts. So the BC Nonprofit Housing Association, ARCO, Achat Québec, Ontario Nonprofit Housing Association, etc. And that's one of the things that we're discussing. In fact, most of the provincial associations have sent out surveys to individual members and individual housing providers. And amongst those survey questions are exactly that. You know, what are some of the best practices, the innovative approaches that providers are doing in response? CHRA is not sending out a survey because we frankly didn't want to duplicate what's already happening. But we're sharing amongst ourselves those results as they come in. So as we start seeing and as we start gathering some information, some best practices, some anecdotes, we'll be happy to share that. And in addition to the Government of Canada website, CHRA has also established sort of a COVID-19 resource page from our website. So as we start gathering some of that material and hearing from providers, we'll put all that, we'll put some of those best practices on that site.
Thank you, Jeff. And I think you have a question, so you can ask that now.
So I had first of all a comment and a question. If any of our members do have ongoing questions, specific concerns, if you're not able to reach out to CMHC, please do let us know. As you can see from the virtual faces that are on the screen here, we have excellent ongoing engagement with CMHC. I should add, by the way, unfortunately, the CEO of CMHC, Evan Siddall, had originally mentioned he was hoping to be able to make this call, but I understand something came up, so he couldn't. But we have ongoing great relationships there, so we're happy to share those. And I know Romy in particular has been very gracious in saying if problems occur or if we can pass on information that they'll gladly receive it. Having said that, my question, and I don't want to put folks on the spot, but it's a question about the loan deferral program, and I think it was Romy you had talked about. I think both Romy, you and Eric had mentioned that for any provider that wants to take advantage of that, the deferral program is in place for 6 months, but that interest accrues on the deferral for whatever period of time the provider requests. Do you think CMHC, as part of your ongoing discussions and deliberations, would consider, as a means to assist providers in a really difficult time, forgiving the accrued interest on a loan deferral for whatever period of time it would be, just as another sort of tool in the toolkit to assist providers in meeting, what potentially could be a number of rents that are in arrears as a result of this?
So Jess, definitely, we'll take this one away. I don't think we can provide a definitive response on this call, but definitely we'll you raise a good point, and we'll take this away for further considerations. Thank you.
Thank you.
Okay, I will move on to the next question. So if a project under the co-investment program is allowed to continue construction since it has been deemed to be essential and runs into additional costs due to COVID-19. Question is, can we apply for our outstanding CMHC PDF repayable loan of $200,000? Or sorry, can we apply for the loan to be reduced by that amount after appropriate request and review, of course, is the question.
I can take this one. I would say I would probably suggest to reach out to the CMHC representative and have a discussion on what's the best way to help in this specific situation. So deferral program is really for, I'm going to say, ongoing projects that are under repayment. For a project like new project under construction, as for co-investment, that are still in construction, deferral program is probably not the best remedy or the best tool that we can use. So I would suggest to reach out to the CMHC representative so that it's going to be a case-by-case situation, and we'll be looking at the best option. And it might be as suggested. I'm not sure about the details of the project, but yeah.
Thank you. So the next question is, so this one again is something you may or may not have an answer to because it's more of that whole government approach, but I think we've been on it, Jeff, about will community housing providers be eligible for the wage subsidy due to loss of revenues? And anyone can take this, but I think, Jeff, we've been doing a little bit of work on this one too. Oh, Jeff disappeared. So
sorry, I'm still here. Sorry, I pressed the wrong button.
Oh, it's okay.
Yeah, I mean, please, anyone jump in, but from our understanding, the wage benefit program that was initially announced by the Prime Minister about a week and a half ago was originally for a 10% payment on a 4 months worth of your wage bill. That and at the time it was confirmed that charitable organizations and not-for-profit organizations would be eligible. A couple days ago, the Prime Minister amended that program. It's now 75% of your wage bill for, I believe, a 3-month period. And nonprofits and charitable organizations are still eligible. There is, however, a new requirement that only eligible organizations would be those who have realized a 30% reduction in overall revenue. There's been a lot of questions as to what exactly that means and how you define a reduction in revenue. Our understanding is the Minister of Finance was supposed to have a briefing on that today, and I just, given preparing for this, haven't heard yet whether he's released those details. But as soon as we get the details on the eligibility criteria, we'll include that on our CHRA page, and we'll send that out in our communications. So I think there's still a few questions about the wage benefit program that we just don't know.
Thanks, Jeff. So the next question is another question about co-investment fund, but also just funding in general from CMHC for various projects. So the comment is, we have had great support from our local CMHC staff for our ongoing construction project, but are concerned that CMHC financial reviewers associated with approvals of each advance request under the co-investment program will have their time redirected to other COVID programs and measures. How do we ensure that we get appropriate approval attention, since we are going to run out of money soon and do not want our construction to stop because of slower process time with CMHC, meaning we don't receive release of co-investment grant funds?
Yeah, so I'll take this question. So I can't comment on that specific project, but I do check in with my teams every day about how our work has been impacted by COVID-19. And I just want to reassure you that from a CMHC perspective, we're available to serve our clients, and there's really we don't see any interruption on our end. So if you are experiencing difficulties, please reach out to your representative and raise the concern and you know, if there is one. But so far, I have not heard of anything. I know that one of the things that we were discussing earlier this morning with my team was that co-investment is it's there's CMHC plays a role, but there's a number of other partners who are involved as well. So we have to always, like, we're trying to be cognizant of the work of our other partners, be they municipalities or provinces, and sometimes we have to work with them in a different way because their attention is on the COVID-19 work as well. So we are trying to be very flexible about how we work, not only with the proponent, but with the other partners involved in the project. And if anyone on the call has is seeing issues, or if they have any suggestions on how we can work differently during this period of crisis, please reach out to your representative, because we're very, very open to thinking flexibly and making sure that the money keeps on flowing so your projects can continue. So that's you can take that as absolute reassurance from me, and please let me know if there's anything that we can assist with.
Thank you, Romy. So the next question, I think, Janet, this one's for you. So in the homeless serving sector, a challenge has been getting the necessary health professionals into our shelters and supported housing buildings. Have there been conversations with Public Health Canada on how we can address this concern with an already strained provincial health providers and whatnot?
Yeah, there have. Actually, we've had several conversations. Parliamentary Secretary Adam Vaughan has actually been having weekly calls with stakeholders, both national and community level, and this is something that they continue to identify, both the difficulty in getting sort of appropriate attention from public health authorities, getting personal protective equipment for frontline service providers, and then accessing health providers for their own organizations. So senior public health officials have been on all of those calls, and we continue to work with them daily so that they can raise that issue with their PT counterparts, with whom they're in contact very frequently. So I think the biggest message that I have heard is, please work closely with your public health authority. If they're not hearing you with respect to the urgent need that the homeless and serving sector has, I mean, that's something that we would want to know. We don't ourselves have the ability to direct local public health authorities or PTs, but we can certainly use all of the channels that we have with the Public Health Agency and others to raise this as an issue. And we're certainly raising it on our calls with senior officials for housing and homelessness as well. So they're very much aware that this is an issue.
Thank you, Janet. Before I get to the next couple of questions, just to let everyone know, we still have a few minutes for questions. If you have any, just type them into the chat and we'll get to them in order. So the next question is, and this has been touched on in this call for sure, what financial relief, if any, is contemplated for housing owners who have CMHC insured mortgages but not with CMHC and are impacted by revenue shortfalls because tenants cannot pay rent due to COVID-19?
I can take this one. So CMHC has communicated to all the lenders that we're doing business with, and we basically communicated the same message that I just did a little bit earlier on, in terms of making sure that the extent any relief, any support to their clients. So lenders need to support their borrowing clients directly and do the same exactly as I mentioned earlier on. So I encourage any housing provider to reach out to his lender, and the lender should be supportive in terms of making deferral. CMHC as earlier on, so I think it's a week and a half ago, as given the authority of lenders to directly approve all deferral of payment directly, without having CMHC to be involved. So it should be a streamlined and easy process for lenders to do so. But I encourage you to reach out to your lender so that they can assist you.
Thank you. All right, as we wait to see if there's any other questions, we have a lot of comments thanking the speakers, but thanking also CHRA and the federal government and CMHC and ESDC. So I'm going to pass those on because that's always nice to, especially in this challenging time. So the next question is, I am interested to hear how the Canadian Housing Benefit or Canada Housing Benefit is progressing. Are we expecting in this time a program rollout soon? And obviously acknowledging this would be based, provincial, territorial. And will there be an emergency Canadian or Canada Housing Benefit response to COVID-19 potentially?
Hi, it's Patricia. Can you hear me?
Patricia. Yeah.
Oh, hi there. Hi, everyone. So on the Canada Housing Benefit, our work has been continuing up until we hit a crisis, but we continue to have our conversations on co-development with the provinces and territories, and we've all seen how Ontario had already announced the Canada Housing Benefit. So in terms of whether we would see any further development on Canada Housing Benefit, or I think you called it an emergency top-up, remains to be seen. I think what government is doing right now is really looking at all options to ensure that we can help Canadians as best as we can. Of course, with the Canada Emergency Response Benefit, it's one other way to that, in addition to the EI support, to ensure that we put funding in the hands of Canadians who are impacted, so that they can not only ensure that they can cover food, but also rent and other expenses. So that remains to be seen. So we really continue to look at all options that are within our federal toolbox, and we have very close relations with the provinces and territories, including during these times where we do as much as we can collaboratively to move things forward. And to really help Canadians as best as we can. We are in constant communication with them as well, so that we have a good understanding of what their realities are like, what issues they're dealing with, and how they are tackling it, and how we can do that together. So so stay tuned for any further I guess development in the near future.
Thank you, Patricia. Okay, so it looks like we don't have any other questions coming in, unless there is one while I'm speaking. I have a brief question that you've already answered, but I know that some people joined the call a little bit later. So I just wanted to make sure if housing providers or homelessness organizations or anyone have, and so I guess this is a two-part, to ESDC and to CMHC, have questions or want more information about the measures that are rolling out and how they can make use of them. What is the best way to get that information? Is it connecting with their local CMHC affordable housing provider expert, or is it the website, etc., for the most timely information and specific to them? So I would say CMHC if you can answer first, and then ESDC.
Yes, so definitely, if you already have a relationship with someone on the ground locally, that's probably your the best approach for an immediate response. But I know we also are constantly updating our website as I mentioned earlier. So I ask you to contact your local representative first, check out our website, and we do have a call center as well, but as Eric mentioned, our volumes are very, very high, so I know it can be very frustrating working through the call center system, even though we're really trying to bring on as much capacity as possible. But we're trying to send out communication on all fronts to make sure that people have the information they need to serve Canadians.
Thank you, Romy. Janet?
So for us on our Reaching Home website, you'll see a list of community entities. So those are the community organizations that receive both the Reaching Home funding and the incremental COVID-19 funding. So my first suggestion would be to reach out to them, because they're at the epicenter of planning and implementing their COVID-19 response. If there's something specific that you're not getting an answer on, or you're just not able to reach somebody, we have an engagement email inbox that I can send to CHRA for distribution, and we can also take questions that way, and then flow them out to our regional representatives as appropriate.
Thank you, Janet. So a couple of questions did come in. As I see, this is how it works. As more people are speaking, more questions are typed. So I guess there are two. One is, they're both follow-ups. So the first is thanking Eric and then asking, the process with some of the lenders is nothing but simple and streamlined, and appears to be at the discretion of the lender and varies amongst lenders. Did CMHC issue directions to lenders, and are you finding that lenders are actually following that direction?
Romy, do you want to take, or I can answer otherwise? I mean, I'm okay.
So I'll start. So we, as I mentioned, we've been issuing a number of communications. We sent a very general communication about mortgage deferrals at a very high level, and we've been following up with very based on the feedback we've received like this, of much more specific direction and guidance to lenders. So we're hoping that that's going to support some more consistency of practice. The challenging thing in this area is that there is each lender is different, and that each loan, each proponent is different as well. So there is naturally a different level of response perhaps that lenders are giving, and I can imagine that this can be frustrating to the proponents. But we're trying to react to this feedback, incorporate it into communications, so that over time we can try to get as consistent response as possible. So we really appreciate people flagging problems that they're having with their lenders, and if you could feed that back to your CMHC representative, it's very, very helpful to us, because we work in close partnership with the lending community, and we will do our utmost to ensure that there's consistency of practice. And I forgot to mention earlier that there's actually on our contact us portion of our website, there's actually a list of our regional representatives. In the event that you're not sure who your regional person is, there's a list of contact names. So we encourage you to go there if you don't have a good idea of who the right person is in your area. So Erica, I don't know if you want to add anything to that.
No, I think it's nope. Thank you.
Okay, thank you, Romy and Eric. So I think we have time for one more question, and then for any of the questions that we did not get to, I'll be able to send them to our panelists to see if there are responses, including the one that was already mentioned at the beginning. So it's a follow-up. This one is a follow-up about the Canada Housing Benefit, so a follow-up to Patricia's answer. So accepting that the pandemic, COVID-19 is changing the context, CHB was still scheduled for implementation April 1st. Do you have any indication of whether provinces and territories are close, or what the new timeline / deadline is?
I don't have a clear update on that right now. So we are closely talking with our provincial territorial counterparts. And we're all in crisis communication mode. So I think that will continue to take precedence. In together with the PTs, and so yeah, so I don't have any other further updates other than we know that we all are here to support Canadians, including with in their needs as it relates to direct housing and their shelter costs. So I would imagine that it continues to be a priority. So no other further updates right now. This was planned to start launching and rolling out in April. So we're still early in the month, and I know that the PTs are looking at their own priorities as well. So as soon as we do have updates, we'll make sure to get those public as soon as we can, jointly with our provincial territorial counterparts.
Great, thank you, Patricia. We'll look out for that. All right, well, I wanted to thank everyone for all the participants in this webinar, as well as all of our panelists. Thank you to CMHC, to Romy, Eric, Veronique, and Glenn for a brief period there, and Patricia, and Janet from ESDC. And to reiterate, like Jeff and everyone has said, that it's an unprecedented time and everyone is doing pretty big and amazing, challenging work. So thank you to everyone, and many thanks for participating. And like I said, we have recorded this webinar, and the recording will be made available later this week. We'll be sending it out through our email newsletter, as well as posting it on our website. And finally, the questions that have not been answered today, we will send to our panelists, and any question that is able to be answered, we will we'll share it with the participants on today's webinar. So thank you very much, and thank you again, and enjoy the rest of your day as much as you can. Bye, everyone.
Thank you very much.
Thank you.
Thank you.
Thank you. Bye.
Bye.